Let's talk about post-operative pain management. In my practice, I use a multimodal approach. So what I mean by that is that I use multiple different modalities, such as non-opiates, to help minimize your opiate requirements. Everything for me starts in the intraoperative phase. What I mean by that is using things like tumescent anesthesia or a tumescent solution, for example with liposculpting, that has lidocaine mixed in that helps really minimize your opiates. The second thing is something that's called Exparel. Exparel has liposomal bupivacaine in it. While it's not lidocaine, it's actually longer acting, and they reside in small molecules or cells that are called liposomes that will slowly release themselves over the course of 48 hours. What that'll do is significantly decrease the burden of pain that you may have after surgery, and then help minimize your requirements for opiates. In addition to the lidocaine and the tumescent and or the Exparel or bupivacaine, we have things like opiates that can help blunt the pain. What I mean by opiates are things like Norco or Vicodin or Percocet. These have varying doses, and depending on your age and what surgery you've had, I can help modify and tweak to help best suit your needs. The things that I want you to avoid, however, are things like NSAIDs or non-steroidal anti-inflammatory drugs. These are like Motrin or Aleve. What these do is they help increase your bleeding time by destabilizing your platelets. That's the last thing that we want for the surgery. So please, at all costs, avoid things like NSAIDs. Other things that we can add are Tylenol. Now, the one caveat that I have with Tylenol is that you don't want to exceed 3,000 milligrams in a 24-hour period. This works in conjunction to the opiates, like the Norco or the Percocet or the Vicodin, that may have Tylenol mixed in with them already. The reason for that is that 3,000 milligrams can be seen as toxic to the liver. So you really want to avoid that, especially in the recovery phase after surgery. But we'll go over all your options and make sure that your pain is as best controlled as possible. Thank you very much.